I love driving. Well, like I say, we've got 3 million miles on you. That's in 25 years.
Randy Cromer isn't the kind of guy who likes to sit around, unless you count sitting behind the wheel of a tractor-trailer, logging those millions of miles. But getting around became almost impossible. He couldn't breathe, and his family physician ordered some testing to see what was going wrong.
She had took me out there to do a stress test, and I had walked up her hallway. She wanted me to walk 3 times, and after about the second time, I couldn't breathe. But they checked my oxygen level, and it was still up 98. It was high, but I couldn't breathe.
That was concerning enough for him to be sent to LewisGale's Dr. Owasu Asamoah, an interventional cardiologist. The doctor's diagnosis: the main valve in his heart, the aortic valve, was failing. For decades, repair or replacement of the aortic valve required open heart surgery. But Dr. Asamoah is among a select few cardiac interventional specialists and surgeons who perform TAVR, the minimally invasive transaortic valve replacement procedure.
And the aortic valve is essentially the valve between the main pumping chamber of your heart and the rest of your body. Sometimes it becomes stiff, it doesn't open very well, which means blood cannot get out. So what TAVR is basically not really replacing the old valve, but going through an artery in your legs, kind of follow your blood vessels all the way to the heart and implant a new valve where the old valve needs to be.
The biggest advantage of this surgery, compared to traditional open heart surgery, is recovery.
Traditional open heart surgery, people are in the hospital for like weeks after surgery, and then even after they go home, it takes them on average about 6 months before they get back to their baseline or where they want to be. With TAVR, mostly people are in the hospital a day or 2 after the procedure, and we say in day 3 they're back doing whatever they wanted to do. So yes, it is absolutely a game changer.
Unlike open heart surgery, almost everyone with this condition can be considered for TAVR. Age and other medical issues aren't a concern with this minimally invasive procedure. But like any treatment, what matters most is, does it work?
If I hadn't had the surgery, I wouldn't have been here. After they had found out the day I was going to have the surgery, they found out I didn't have but 8% usage of my heart instead of 10%. And I think one of the doctors said I was probably a week away of having a stroke. But like I say, I could really tell the difference once I came to, just on how much better I could breathe and move. But as far as I'm concerned, the man saved my life.
Some of the symptoms your aortic valve is failing are feeling lightheaded, irregular heartbeat, shortness of breath, tiredness, even after plenty of sleep, swelling of the ankles and feet, and not feeling like yourself. If you are feeling any of these symptoms, contact a LewisGale physician today.